Everybody, it's Dr. Eric Balcavage, and we're back for another edition of Thyroid Answers Podcast. I have with me my cohort and partner in the podcast, Dr. Erica Riggleman from Winchester, Virginia. How are you today?
I'm doing great.
So we have a special guest on today, and it's Shalini Bhat, who is a functional medicine practitioner, doctor of chiropractic. She's Pilates certified, and she's got a bunch of other things that she does as well, acupuncture, I believe, and she has a practice called the Movement Boutique. And so we have her on today, and she's joining us live from somewhere, I think, up north, right?
Toronto.
Yeah. So how are you doing today? Thanks for joining us on the podcast.
I'm awesome. Thanks so much for having me.
So can you give us a little bit of background so our listeners have an idea who you are, how you got into this space, this functional medicine, chiropractic space? Everybody's got a story, so we want to hear yours.
Yeah. So it's really funny. I feel like all of us who found functional medicine have had our own personal story of some type. And I think we all end up having our own lens of a problem and then our lens of a solution, which kind of ends up being our own brand story, if you will. For me, growing up, I always had kind of stomach aches and bloating, and I was always tired. Like, I was like, how do people wake up in the morning? I don't even know. I would always get colds. So I kind of had those things that were what I call boring medicine, meaning, my father is a surgeon. So I had access to, medicine, so to speak, but, bloating isn't solved by anything like that. Tiredness isn't really solved by, a drug or a pharmaceutical or a surgery, which is where, GP allopathic medicine excels. So my background, I'm also half Indian, and my family in India has a huge organic farm. And so I was also exposed to kind of the Eastern way of medicine. I remember flying over to India and I was feeling so nauseous, like, talk about gut brain stuff. I could not fly there, and I was so sick and vomiting the entire way. And my grandmother, who didn't speak a lick of English, gave me this herbal concoction shot. And within 2 seconds, to this day, I don't even know what was in it, but I just took it, and I was like, whoa, nothing had ever worked that fast in my life. And I was like, what even was in there? And it was just like some plants, some herbs. I was like, what? Right? Because I was raised to be like, medicine is the, only thing that will cure you. So I had kind of this Eastern and Western philosophy, or inkling of an interest, I'd say, from a younger age. And again, with these boring medicine type symptoms that I was experiencing and not having any sort of, Band-Aid solution, which is what I grew up with. You have a problem, you got to slap something on it to make it go away. Right. So yeah, I also, to your audience, thyroid stuff runs in my family. My mother, my grandmothers, my aunts, and now one of my brothers have thyroid issues. However, for me, I think all that subclinical stuff that was happening to me, 10, 15 years ago, or 10, 15 years ago is when I started figuring it all out. I think that's actually prevented me from getting a thyroid condition at my age now, just by fixing the things I did back then, diet, lifestyle, my gut, addressing all that stuff has actually prevented me today from having a thyroid issue. So, my backstory is I come from that transactional medicine background of problem, slap a pill, and I was able to kind of find this transformational medicine space where, you again can actually affect your physiology and prevent things by, as you guys know, stress, sleep, diet, supplementation, exercise, and all the rest of it. So that's sort of, the lens of where I'm coming from and how I ended up finding functional medicine, started with chiropractic, acupuncture, and then there was just something else while I was going through my own personal health challenge. And I was, again, able to remedy that with all those tools. And then I was like, whoa, this is powerful. And so I've started using all that in my clinic too, to make such profound change for the future for people. So I work with subclinical things before they would turn into something.
Yeah, that's an important piece. Go ahead, Erica.
Yeah, I think that, that connection of most people find functional medicine by asking the why, or, I feel like something's missing, and it's that search for wanting to help more people or fill that void of, I've gotten you this far with the structural work, and there's just something missing. And so I love your philosophy and your practice, but you have a slogan in your practice that vitality is the new vanity. Could you explain to our listeners what vanity and what vitality mean, and really how did that come about as your slogan for your practice?
So how that kind of came about was, I sat down with a brand manager earlier this year, and she was just asking me about my story and about the target market that I see and the type of patient that comes in. And as I was chatting, I think that sentence just came out of my mouth. I was like, I feel like women they want the vitality piece, but it's masked in a quest for vanity. For whatever reason, society has thrown that to women. We don't look good enough. We're not skinny enough. We don't have thick enough hair. We don't have the right frame, proportions, whatever it is. So for me, because I want to find that subclinical patient, I want to find that patient who hasn't yet gone down that path. The thing that they're Googling, the thing that they're looking into is what is reflected to them from the outside usually. And why I say that is because people usually consume wellness for only two reasons. Number one, they've got a symptom or something, a disease or a diagnosis or something that makes them change their habits, right? Because wellness is really habit oriented, as you guys know. So the only other reason people tend to change their habits is, they have that vanity piece. They're wanting that last 10 pounds, that body composition, smoother skin, whatever it is, right? So for me, it was really important, especially my story is bloating, and I grew up dancing. So, I was always, quote unquote, a skinny kid. But, you go through puberty, you are aging while you're dancing, in that kind of later teens, your body's changing, and dance is a very outside, you get measured every year. It's you're very aware of what your body shape is at the time. And for me, I was like, oh, okay, my stomach's so bloated. Like, what is this? Right. And I was like, I want my stomach, my actual stomach back. Where is it? Right. And, for me, again, it wasn't a weight piece, but I just knew it was expanding. It was uncomfortable. But the only thing I knew to look up or look at was like abs or like, what was my stomach at that point? So one of the pieces now, when we look at the core, the stomach is, I want to educate people that it's just not about what's right around your tummy. We need to look at the distribution of the fat or inflammation. We need to look at the gut. So, how your body's absorbing its nutrients. We need to look at all the muscles that are in that area. We need to look at, even the diaphragm. It's how the rib cage is going to sit on the pelvis. So how that will look. So just empowering people to understand that there's so much more to quote unquote, chasing vanity. You can actually chase vitality, which is that feeling good. So we have another saying at the Movement Boutique, my practice, that we help people move better, feel better, then look better, which ends up being a side effect of quote unquote chasing vanity, because again, doing the old school tricks we used to do in the 80s and 90s just aren't working for us anymore now in the 2019s because of our world and our environment. So really just empowering women to know that there's way more than kind of that outside in approach.
Yeah, I think that making people bridge that gap between you're coming in with these superficial issues, but they're much more deep-seated. And so there's plenty of things you can do on the surface to band-aid it, just like anything with a disease or a problem. There's a medication for anything. You come in and you've got wrinkles, there's Botox you could do, or there's other things that you can do from the inside out, working on your hormones, maybe doing some more natural things to help exfoliate the skin, increase collagen production. So there's all of these things that you can do, but I think it's making people realize that there's deeper problems going on, that those are just symptoms, wrinkles and dark circles and, all of these, weight gain, those are just symptoms that something else is going on that we want to take a look at. And education, I think, is really important to bridge that gap.
Totally.
So would you say that like your kind of avatar of your patient is the person who's already coming in, hey, I have got chronic hypothyroid conditions, or I've got these issues. It sounds to me like your avatar is the person who doesn't really realize that they have those things. And they're really just coming in to say, hey, look, I want to get my bikini body back for summer. I want to look good in my clothes. I want to lose these last 10 pounds. I got this muffin top that I need to get rid of, right? So they're coming in maybe for those reasons. How do you get that person? Because that may be a tough sell for some people. They really just want to come in and have you say, give me the right exercises to fix this. How do you then make the transition for that person to say, hey, look, your weight issues, right? And that you're concerned about, that last 10 pounds may not really be just a calories in, calories out issue. And you want to get the 6-pack abs. Well, maybe not everybody gets the 6-pack abs, but the reason you don't have the 6-pack abs isn't because you don't do 1,000 crunches a day. Maybe the reason you don't do that, you don't have that 6-pack abs, and you don't have the right, ab structure, or your glutes a little saggy, is due to a metabolic issue. How do you make a change like that? Because a lot of those people have probably been told, hey, your labs look good, you just eat less, exercise more. How do you make that transition for them?
Oh, that's such a good question. I think because my practice services a manual practice side as well, so people might have come in, I guess if you're talking about my avatar is kind of a woman who has had her kids, and then she suddenly wakes up out of that fog one day and is like, hold on a second, I don't feel as energetic as I once did, which is, again, not a quantifiable, because like, what's feeling 40% more tired than you used to? Like you said, she's just kind of got that different body composition that she doesn't resonate with anymore. And she's not sure where it went, because she's trying all the tricks that she used to use in the 90s or before she got pregnant. And they're just not working the way they once did. So she's coming to me because she's kind of tried all the Google stuff. She's tried all of the tricks that her friend has told her about, and what they said at her latest gym class, and what her mommy's group has said. And then she's done her own researching. So my avatar is actually fed up with trying to figure it out herself. And she comes to me for the customized roadmap on how to get her back on track for all of those things. And a large way that comes about for me is through the gut. So most people are coming with, digestive, well, I'd say they don't have optimal digestion. So either they're coming for, again, from that midsection, from bloating or constipation, or like it's got some root in the gut. And then we're talking about all of the other things because of that. Or she might have come into my studio to start working out, to your point, to lose that weight. And then we start a conversation and we talk about the ways in which having thinner hair now, losing the eyebrows, having less lashes. Because by the way, like what's really popular in my area, I don't know if it's popular with you guys, is they'll tattoo their eyebrows on nowadays. They've got fake lashes like that are kind of semi-permanent, hair extensions, and just educating that these masks in the beauty industry, so to speak, for these problems have a much deeper rooted issue. So we'll talk about, the gut, for example, and how if you're not absorbing even the amazing nutrients you're taking in from your diet that you're trying, then that's a problem, because those nutrients will then go to nourish various organs, or in this case, the thyroid, for example. If it's not getting its nutrients, then we're going to end up with a thyroid condition if that's where our vulnerable area is. And that's an absorption issue. That's not even an intake and outtake issue. They might be having bowel movements. They might be intaking pure, organic, amazing food, right? But if there's an absorption issue, there's an absorption issue. So it's about sort of educating them that these labs we're going to run, these functional medicine tests that we're going to run, is going to give us a customized roadmap. And the side effect, so to speak, will be tuning into those organs and getting that hair growth back, getting those eyebrows back, getting those lashes back. That's one of my personal stories. Like, I can show you photos of, like, my hair was so thin when I finished university. Like, I still remember one day putting a ponytail and like being like, why am I still putting this elastic around and around and around? Because my ponytail was so thin. But you don't notice it when it's happening. You just suddenly one day, because you're with yourself all day long, right? And every day. So suddenly you go to do your ponytail ponytail, and you're like, wait, I used to only do this up 3 loops. Now I'm suddenly doing 4. Where did that volume go, right? So it's a slow progression. And for me, especially when it comes to thyroid stuff, I feel like for a lot of people, it's a very slow and steady decline until one day they're like, oh, maybe they were lucky that their TSH was off, right? Because that's usually, I don't know about where you guys are, but where we are, TSH is the only thing they're going to run and see. And only if TSH is off, and the reference range is like, from here to California, East Coast to West Coast, if you, but like, so only if they're lucky. I was working virtually with someone in Saskatchewan, which is a different province in Canada. And she was saying they absolutely will not run, if your TSH is normal, they absolutely will not run another marker. And right. So, it's that, okay, well, I guess we'll assume it's subclinical, and here's what we'll go at it from a different lens, so to speak.
Yeah, I think that there's also a normalcy that comes to, the eyelashes and the eyebrows and the, hair extensions that you see everybody else doing it. So you automatically just assume like, oh, that's not a big deal. I don't think that that's a problem. Or, oh no, that's fine. I just, got my eyebrows filled, or, I just have my extensions, and they think of that as being normal. But I think we have to kind of flip the script and say, no, that's not a normal thing. You shouldn't have to do those things. It's perfectly fine if you want to do them, but there's something going on in that, just getting eyelash extensions and fillers in your eyebrows and, all those things are just kind of putting a Band-Aid on it. And we do have to kind of bridge that and make them realize that there is something deeper seated. I know in our clinic, we do hair restoration with exosomes and PRP. And my nurse practitioner often has to kind of tell them, look, we can do this procedure and you may get more hair growth, but if we don't look at what's causing this in the first place, whether it's thyroid issues, or maybe it's a man who has some hormonal issues with testosterone, androgenic testosterone, we want to look at those underlying things. Or maybe it's just stress. Maybe that's why the hair is falling out. If we don't address those underlying things, this is probably going to reoccur down the road. And so making people realize that, yes, we can have something superficial that we can slap a Band-Aid on it, but we want to then also address the underlying root cause.
Absolutely. And I think, to your point, I think it's awesome if women in the meantime want to get doing those things to make themselves feel better, to boost their self-esteem and their self-image in a sense that will allow them the confidence to go after these things. Absolutely. Like, do it up. But I just want people to understand that those, like you said, can be underlying metabolic conditions that do need to be addressed.
Yeah, and I think that it's important to touch base with the listeners, and if they've heard us talk about this once, they've probably heard us talk about it in every episode of the podcast. Our perception in functional medicine, especially in where we sit, and I'm sure you kind of agree with that, is that really what's going on is not, in allopathic medicine, they're doing TSH only because they're waiting for the gland to become dysfunctional or diseased and then take action. And that's just allopathic medicine. That's just the way it is. And so you might, we get angry in functional medicine, like, why wouldn't you do more than a TSH? And that's because the model is set up that until TSH is out of range, that you don't have a thyroid issue. But our perception, especially what Eric and I talk about all the time, is really it comes down to cells. It's all about your cellular health first, right? And so whatever's creating cellular, when you get that perception, the cells perceiving danger, you're going to get changes in thyroid physiology signaling within your cells. That's what causes the hypothyroid symptoms. So you could easily start losing your eyebrows and your hair thinning, and you starting gaining weight slowly and progressively, because what you have is a cellular hypothyroid condition. The gland is still pumping thyroid hormone. It's still kind of keeping up. And if we haven't said this before in a podcast, there's two major issues when it comes to the TSH. One, it is suppressed by the primary problem that the vast majority of the people have, which is inflammation. So if the number one condition in the US, Canada, and everywhere else is chronic low-grade inflammation, which favors deactivation in your cells, but it also suppresses TSH. TSH isn't a valid marker of thyroid physiology. And it's not even a great marker of thyroid gland health, because now we know that you can have nodules growing for weeks, months, or years, which means disease of the gland. And what a recent paper showed is that you have up to 90% destruction of the thyroid gland by the time your TSH goes out of the established lab range. That is not the beginning of a thyroid problem. So it's really important for us as the functional medicine practitioners to say to somebody, I know your doctor said you don't have a thyroid problem, but you have a cellular health problem, which is why you have the issue. And thyroid hormone plays a massive role in your cellular health. So if you have weight, if you're tired, if you're fatigued, if your hair's thinning, if you have a blood sugar problem, you have a cellular thyroid issue. And our job is to help you see that before it becomes the condition, and then not flood you with more thyroid hormone to fix that cellular issue because your cells are already busy deactivating it. Instead, we have to go back to what you just said is like, listen, a lot of this stuff has root in the gut. And that's a hard concept for many people because they say, I don't have a GI problem. And they may poop every day, right? They may have a little gas, little bloating, or maybe none at all. And they don't perceive they have a problem, but they're insulin resistant, right? They have a glucose problem. Well, most people don't even realize that their GI tract and the enzymes that are released from their GI tract in the first 2 to 15 minutes of their consumption of food determines what their insulin response is going to be. So if you don't have a healthy gut, and you don't have a healthy GLP-1, you're not going to get 50% of your insulin's released in that first 2 to 15 minutes. If you miss that, you're going to have a blood sugar problem. You're going to start putting on belly fat, right? And so it is so critically important to look for those causes, but it's not being taught elsewhere. And then they come to somebody, you, Erica, or I, and we have to now say to them, look, I know you were told you're optimally healthy. It's just an exercise or calorie issue, but your hair, the reason you have weight issues or these things are happening is because something's wrong with your cells. They are not working well, right? Would you agree with that part of it?
Oh my God. I love what you just said. And to your point, allopathic medicine, a lot of the time is looking strictly at output of a lot of things. So I love what you say about cellular sensitivity. So they're only looking at a production piece. When we look at, a linear score of, even T4, T3, TSH, it's like, it's always a too much, too little game. Well, like, where are we measuring cellular sensitivity here? Where are we measuring transport? What's the cell wall like? Is it receptive to actually bring that in? Are you having enough omega-3 fats? Is the cell wall fluid and fatty like it should be to be able to derive that in? Are we detoxing the stuff we don't need, right? So I love what you just said, because that's a piece that I really, really cornerstonely educate people is it's not a too much, too little. And we can't just always look at that. And it really has to be about, cellular sensitivity and other things, to your point, that you can't, this is Thyroid Answers Podcast, but you literally can't, tease out an organ the way we do in allopathic medicine. The only time that's a really necessary thing is when that's a very diseased organ and we need to just look at that one organ because we need to surgically excise or give, something like Cushing's or Addison's or something where there's an actual dysfunction or issue. And that's going back to what I was saying about that transactional versus transformational medicine, which I know you guys practice too, right? Transactional is too little T4, we're going to give you Synthroid or whatever, right? And what's the transformation? I remember my brother got diagnosed with Hashimoto's. My brother went through a hugely stressful, few years, and he was living in a, student housing type thing. I'm sure there was, it was not optimal.
Right.
Ended up going to the GP. Again, I have 3 older brothers. We grew up in an allopathic house. I'm the only one who, not that the medicine we practice is alternative, but it's a eye opener for people.
Yeah. So
he went to the GP and I asked him, why are you taking this, Synthroid? And he's like, oh, Shalini, you'll never guess what. I went to the doc. I don't even have any symptoms. They tested my blood work and he just said, oh, just take this med. It'll even you back out. And the doctor said to him, imagine that, you're not even having any symptoms. So, and my brother's not body aware, by the way. So I'm sure he's having something, just doesn't realize it. And he's like, oh, you just need to take this drug for the rest of your life. And my brother's like, oh, that's awesome. This is fixed, right? So there's this mentality of, and I'm sure you guys know your family doesn't listen to you, right? Because like they like earmuffs, what you say. Yeah.
Mm-hmm.
So it just still goes to show he got this transactional experience that he was like, all right. And now, you know, we haven't changed. He hasn't changed any of the things. I mean, he doesn't live where he lives anymore. And he's living a different life. This is now years later. But, you know, was he able to change his cellular sensitivity, let's say, as an example, right? Were those cells resistant at the time to many different signals that were necessary, right? Was his digestion even happening at all? Was he absorbing anything? So these are, you know, just going back to the difference of the type of medicine we practice, which is transformational versus that transactional, which I think a lot of people get blinders on about.
Yeah, absolutely. And the challenge is it's a long road to hoe, right? Because we have, and it's funny, I never even thought about, but when you said it, because you kind of said him, and then the doctor he went to was a him, and then you said mentality, and I'm thinking, is it a male? Is part of the problem that was driven by men, right? And we have this certain, hey, just toughen it up. Here's the thing, it'll fix it, versus maybe being a little bit more inward perceptive of, hey, maybe there's something wrong with the physiology and the nurturing side, which may be more of a female thing than a men thing. And this was, maybe medicine was a thing that was initially dominated by men. And so it was the, you know, how, you know, stop crying, wipe it off, get up, just take this, you're fine, get out there. And maybe that mentality set the stage in medicine for where we are today. And it really, maybe it takes a different mentality to make that change. So maybe it's one of the reasons, as more females come into healthcare, we start to see more of a change. I don't know, just a thought. I didn't think about it, but it hit hard when you said that. I was like, mentality. How you said it, I was like, because I think we do that. I mean, I think a lot of women early on definitely got blown off for their things. You just have a bleed issue. Don't worry, we'll fix it, right?
Well, it's funny, like, just to speak to that, a male perspective is kind of a quick fix perspective. Like, so I deal predominantly with females because women tend to be more introspective. And because I mentioned that I see that patient who they don't have a diagnosis yet, right? And then, of course, their husbands and family members trickle in. So I do see men. But this is the difference between a consult with a woman with me and a consult with a man. A woman will be like, you know, I've been feeling a bit more tired. I can tell my stomach's a little bit, my digestion's a bit slower. I tend to be a bit more foggy. And she can describe it like that. A man, you know, you ask, so tell me a little bit about your health picture. Well, you know, I'm 6'2", I'm 180 pounds. People would say I work out enough time. And he's seeing himself from the outside and she's seeing herself from the inside and the outside. And, you know, I always it's just, to what I was just saying about the pills, men tend to sometimes just want, work with a lot of high executive level men, and they're like, oh, these are my test results. Okay, cool. What do I got to do? They just want that thing. Women, it's so much easier to, you know, kind of instill those slow, steady lifestyle things and kind of tweak it with them. Whereas the men, they're like, well, you said to do this one time, you know, so, and you're like, oh, well, you know, now we need to kind of do this. So I think that quick fix transactional pharmaceutical thing is a bit more to your point, especially with the high level executive male, which is the one I tend to work with. It tends to be just, you know, back to the trading floor. What do we do for this, you know? So
I think men have a hard time accepting that there may be something on the inside that's not working. And that's why they always project it on the outside. Women can accept that, okay, something's not working on the inside. And that's why men, I feel like often are just like, well, give me what I need to do on the surface. Give me the pill, give me the supplement, give me that one thing to fix it. They don't want to admit that there's something wrong on the inside.
Yeah.
And listen, I'm the man, the dude.
Yeah.
Right?
Tell us what you think.
I think it's absolutely true. And it's part of the way I think a lot of people are brought up, you know, guys especially are brought up, don't show emotions, just dust it off and get up there, be tough, just toughen it up and do the quick fix. And I think that impacts, and when we're talking about health of people, we talk about the state of emotional health as being a massive thing, right? And people don't, you know, especially guys don't want to hear that, right? Danger, fear, anxiety, that scale, right? guys have a much harder time discussing those things. And I think it impacts, especially when we're talking about dealing with couples, right? We see that for why there's frustration when the female especially doesn't feel well, because as a guy, our mentality is, if you're going to complain to me and tell me what's wrong, I want to help you fix it, right? I'm a hunter, I'm a gatherer. I'm a buyer, I'm not a shopper, right? I'm not looking for, I don't want to mush it. I just what's your problem? I'll fix it for you. But that's kind of the mentality of a lot of men, which really does make it difficult for them to get well. And I think it makes it even more difficult for them to really feel helpful. And I think it creates challenges in relationships, because the man wants to fix it. And if he can't fix it, and then the doctor says, hey, there's nothing wrong with you, we don't have the emotional IQ many times to be able to be supportive and say, okay, there's got to be something wrong. Instead, we hear the bitching, the moaning, the complaining, and say, you're just depressed, or you don't love me anymore. And I think that creates a lot of stress. I see it in my practice. When you see a husband and wife come in and you see the spouse comes in with them and they're very supportive, I mean, that's a much easier patient to get better versus the person who their spouse either comes in and sits there with their arms crossed, right, with that negative attitude, yeah, or they're not willing to come in, or the person who you're trying to address says, I don't even want them here. And because they don't understand what I'm going through. And I'm like, man, we have to fix that first, because if we don't fix that piece of it, they need to understand that there's a real issue going wrong here, right?
Totally.
All right, so we got to get into the next piece, and that is, we're talking about metabolism, but you do a lot of work with fascia. Many people may or may not know what fascia is. And so what's the role of fascia? And some people are like, you guys are just talking about gut and blood sugar, and now you jump to fascia. But fascia plays a really important role in the physiology of how your organs, cells, and tissues work. So can you tell people what fascia is and what its role is and why it's so important?
So fascia is the white connective tissue that surrounds absolutely every single part of our body, from our muscles, our bones, our joints, our even the muscle fibers themselves. And organs. So one of the important things to know, it's like, actually, just to give you a visual, if you open an orange, you can see the orange, the little droplets are segmented, the wedges segmented, and then the whole thing is segmented. So that's kind of how fascia divides the various parts in our body. It's why when we stand upright, our entire organ system doesn't fall right into our pelvis with gravity, right? Things are suspended up there. So when I started my musculoskeletal practice out of chiropractic college, I was working a lot with the soft tissue and the fascia. And like looking back, I was super inflamed at the time. So getting treatment was almost like a little bit painful sometimes, because, when you put your hands on someone and they're like, and you're like, wow, I touched you like just as much to bruise a tomato, like barely anything, right? Because we all have these different inflammation going on, obviously. So the role that fascia plays in terms of the gut, I think it was 2 years ago that a huge study came out, and it's like, actually, yeah, the mesentery is fascia. And the mesentery, for those of you who don't know, is the piece of film that actually holds our intestines up in our bodies. And when you think of all the sayings around gut, for example, my stomach was in knots, right? Like that kind of a saying. I want you to visualize that, kind of center tightening, for example. So if we're looking at, hypothyroidism or constipation, whatever you want to call it, slower bowel movements, one of the things is expansion in that area and allowing that fascia to relax. So again, the fascia is running absolutely everywhere in our body. So, and it has its own, nervous system, so to speak. Like if you think of someone tight and anxious, they're all shoulders up to their ears, jaws clenched, like they got that. Whereas like someone relaxed and who just came out of a massage or, meditation, their shoulders are down, their alignment is nice. So one of the ways that fascia, that I see that with the gut, is again, that kind of like tight, like when you touch your abdomen, it should be soft and, relaxed, but some people have really tight fascial spots in there. And that can, of course, affect the flow and digestive mechanisms of peristalsis, which we know is very, very important in, inflammation and clearing the bacteria from top to bottom, or pushing it back down into the large intestine. Again, constipation, I would say, is a symptom of hypothyroidism. And one of the things that I teach patients to do, I don't know if you guys are familiar with it, but the ileocecal valve massage. Getting that valve, that super, super important valve between the small intestine and the large intestine, for those of you who don't know, that valve can become somewhat dysfunctional. So if you picture the intestine being, a circle, so to speak, if you were to squish it and make it an oval and there was meant to be a valve there, that changes the shape of how the valve is going to sit. So in some people it can kind of be, cocked open, and some people it'll be stuck closed. So that's a simple technique that can demonstrate the connection of how fascia can change the shape of, or the movement of, the gut. And it's something that I work on with my patients.
So are you mainly recommending for people who think they have some sort of fascia issue more of a massage, or is there a particular technique that you recommend? I know that I've seen people who use specific tools, whether gua sha or like other tools to kind of loosen the fascia.
So for us, at my practice, I've sort of taken all the best ways to release fascia and I bring it into one technique. Every single person is different, which I know we're going to get into. So even there's research that demonstrates that, whether you do a stretch, whether you do a foam roll, whether you use a tennis ball, whether you use, to your point, some instrument assisted or self-assisted fascial release, or whether you did it with hands, that it actually doesn't matter. Both groups usually are feeling a difference. So what I would suggest is for that person to, try what resonates with them, what makes them feel different. And then of course you can get, because the nervous system is running through our fascia as well. Like let's say you get a back massage or something. As you guys know, the nerves that feed the stomach area, the digestive tract, are coming out of there. So maybe that was enough to help it release. Maybe that person actually needs that abdominal work, through there. Maybe their hip flexors area is really tight, pushing their organs forward more. So maybe it's more a sports work that they need done. So in my clinic, we do it all. It's kind of the way that our technique is special, but I would just say to try whatever it is. And I just want to introduce that because often we think of digestion stuff being only a nervous system issue or microbiome issue or an internal issue. So we can actually get at these things also and wake them up through manual and touching and changing how that fascia orients as well.
So I want to just kind of circle back here a little bit for the listeners. So we're talking about metabolic issues can cause things like weight gain. We started talking about how it ties to thyroid physiology. We talked about gut. So for the listeners, I want to make sure you understand that if you don't have good gut function, good gut physiology, that can be a thing that triggers inflammation, that can trigger cell stress, that can cause cellular hypothyroidism. It can trigger glandular hypothyroidism, it can trigger Hashimoto. So that's really important to have good gut function and gut motility. And decreased thyroid physiology can slow the motility and alter GI function. So you need thyroid hormone for motility, and even the thyroid gland makes a hormone called motilin. And so as your thyroid gland gets more and more destroyed, there's less and less motilin being released from the thyroid gland. So that you start to lose that migrating motor complex or the movement of it. So there's a huge role between GI problems triggering thyroid physiology, both at the cell and the glandular level and autoimmunity. And when there's decreased thyroid physiology, it affects the movement of the bowel. And what we just jumped into is talking about fascia, and fascia is that connective tissue. And if there's restriction in the fascia, that can be a thing that is another thing that limits bowel movement and motility, which can then be the thing that starts to create the dysbiosis and the overgrowth and the leaky gut and the cascade that could trigger it. So let me then let's talk about the fascia. We know it's this connective tissue. You talked about working the GI tract and the fascia of the GI tract, but fascial adhesions, fascia is a connective, it's like an organism of its own, right? Or we could just call it an organism of its own. And so for people, and you were talking about, hey, they could have so tender on their back or so tender on their leg or so tender somewhere else. It doesn't just have to be fascial adhesion in the GI tract that may affect the GI tract, right? So because it's kind of a contiguous piece of tissue, fascial restrictions in one area totally separate from your GI tract can be a thing that still plays a role. So can you just clean that up a little bit?
Yeah, I mean, so one simple way, so again, that fascia is running absolutely everywhere, from the bottom of your feet, wrapping around your skull, every absolute way in your body, inside and out. By out, I mean surface level or deep inside our bodies. So as I was mentioning before, like let's say someone says something to you and emotionally you feel like, hurt or angry or upset, your body naturally kind of tightens up or contracts, right? And it will feel like that everywhere, whether you realize it or not. Your gut will tighten, your shoulders will tighten. That's our fight or flight response. Another way people can think of that, of how fascia can affect our physiology, which will consequently affect our thyroid gland, I always talk about, is breath work. So our rib cage should expand and contract to allow that breath work. If that fascia is very tight around the rib cage, around the diaphragm, around the neck area, the person can't take an expansive inhale and a full exhale, right? That rib cage might be stuck, what we call stuck open. So it's stuck on the inhale, or like a, sadder person, it might be stuck on the exhale, right? So it just depends on where that fascia is sitting. I remember when I started getting into breath work, I was like, okay, I'm going to take a deep inhale. You can only deeply inhale as much as your physiology will allow you structurally. So going back to parasympathetic, sympathetic response, one of the ways we can help our body shift into a parasympathetic response, which for your guests is healing, detoxifying, digesting, all those good things that we want, that in and of itself will only get the message if we're able to take deep, expansive breaths. The sympathetic, which is our fight or flight, we're that shallow breathing, right? So just in order to shift into that parasympathetic state, we literally need to be able to expand and contract the rib cage to give that signal to parasympathetic to say, no, we're cool, we're okay, we don't need to be in survival mode. So even something as simple as using a foam roller or fascial release or breath work to physically open and expand and allow the rib cage to get to that deeper breath work is another way you're powerfully, and it's totally free, to change the system into a parasympathetic state.
Yeah. So for the listeners, when you have tension in your fascia, we often talk about what's creating a cell danger response, right? So what we're talking about is that if you have tension in your fascia, anywhere in the fascia, that fascia is a continuous thing. So it's giving this danger signal. And when you have that danger signal, we've talked about this multiple times on the podcast, your cellular physiology changes from making energy to self-defense. And those two things are extremely different. So you're creating the danger signal. And we said, even when the body's in that state of danger, one of the things that happens to thyroid physiology is essentially there's a net down regulation of it. And so the organ systems, the things that are needed for rest, digest, hormone production, those things get down regulated because they're not so important to survival. And the things like increasing your fight or flight hormones, increasing muscle tension in anticipation of the perceived danger are going to get upregulated. So you can start to drive hypothyroid state in your cells due to this fascial tension. So from an old trauma, from an injury, from emotional stuff, you get that fascial tension. Once you have that fascial tension, then it can trigger this to the rest of the cells of your body. Hey, we're in danger. Now we're going to start deactivating thyroid hormone in our cells. We're going to start to have less thyroid hormone supporting hair, skin, hormones, and we're going to have symptomatology. Thyroid gland's still working initially, but if that danger signal stays persistent, then it can trigger the immune attack on the thyroid gland because of what's released from the cells, these danger signals that are released from cells, these things called DAMPs and PAMPs, and that can trigger the autoimmune attack. So what we're trying to get across in this podcast, and hopefully it's coming across in this one, is that it's not just this mistake of the gland to go dysfunctional, right? And it doesn't just, that's it. It's the way it goes. Something's occurring, and we often talk about the diet and gluten-free and all that. That's just like a drop in the bucket of the whole thing. And that's why so many people, and that tailors us right into this concept of bioindividuality. When you say, my friend, it was hypothyroid and they did gluten-free and they feel better, but I did gluten-free and I don't feel better, because that may not have been your issue. So can you speak to this topic of bioindividuality and what that means?
Yeah, just to, I'll get to that in one second. Just to circle back to what you were just saying is exactly that. Like, fascial release is such a nice entryway into something where people don't have to do the inside work. So if they're not yet ready to do some type of change, then maybe go with an outside in approach, like breath work, like we just talked about, and expanding, or, moving in a different way. So maybe they're doing really tight, like spinning and running and like all the same range of motion type thing. So maybe something more expansive like yoga or Pilates or, then fascial release work or acupuncture. Like doing that outside in thing can actually help drive change, to your point, if they're not ready yet to change their diet or do the inside stuff that we were just talking about, which goes into what we were saying about bioindividuality. You guys, are in clinical practice too. So I'm sure you hear all the, we're in the age of Google. So everything's trending, like lectins is trending right now. I know it is a conversation I keep having with patients. Keto's trending right now. So these things will cycle in and out, and we'll hear about it, and books will be bestsellers. And what I tell my patients is, again, in my clinic, because we'll run all kinds of testing and I'll give them the roadmap for themselves on what I found in the testing. But what I also encourage people to know is that not only is your microbiome completely different from even your spouse, even like your family, like who's living under your roof, your genetics are completely different. Your lifestyle is completely different. How you prepare said food is different. So even when we talk about, let's say in our world, the category of legumes, blood type, I know people will talk about that. Again, ancestral microbiomes, genetics, and so forth. Not only, can you just handle it, yes or no, and what's in your gut, but ancestrally, like, again, my family is from India. So how we cook legumes is 100% different from how they show up on our plate in North America. So, again, even a food that we're talking about isn't the same as itself when we're speaking of it, right? Even literature, when it's talking about meats, was it done on a grass-fed meat or was it done on a conventionally farmed meat? So I really teach people to, as much as we might suggest gluten, dairy, corn, soy, sugar, eggs, whatever, we're doing it as an elimination top, as you guys would know, if we're starting out with someone and you're taking everything out for starters, that's great. But then how do they long-term navigate and figure out? So you introduce them to what might be affecting their physiology. So for some people, I know I had a patient a couple of weeks ago who was like, she looked up FODMAPs on her own and was like, I noticed the oligosaccharide category, like that entire category is no good for me, but she's fine with everything else. So it's about giving people the tools and strategies to understand that, this is a huge topic I talk about with my patients, is resilience. So to your point about gluten, maybe gluten isn't affecting you in the dose that you're taking it in. So maybe the friend that says, I tried giving it up, it didn't work, or maybe they minimized it, who knows, right? But if you, as you guys know, that gut insult, the gut starts repairing itself right away as soon as we've had that gut insult. So maybe that person's repair mechanism is really quick. Maybe they haven't gotten to that point where that gluten is creating that giant leak, so to speak, or gut damage, where it's taking way more than 72 hours to repair itself, which they would then be noticing the symptoms of, right? So it's not to say that those things aren't causing the damage to the gut lining. And sorry guys, why I keep bringing up the gut is because that's where we're absorbing the nutrients to help the thyroid, but and that's what I work on predominantly. But it's about that resilience piece. So again, I teach that woman in my practice that only push yourself or only step outside that kind of line that we've given you when you can bounce back from it. So the example I give my patients is, if you have a job and your expenses are covered and you're pretty good at savings and you come across a cute pair of shoes that's a bit out of what you would normally spend, you're like, should I splurge or not today? Yeah, I'm going to splurge. And you only splurge when you know you can recover it, and you then won't be losing your home as a result, right? Same with health. I tell them, because nobody can live in that bubble of an elimination diet forever and ever on 25 supplements. It's just not going to happen. So I love empowering people to know that if they step outside the line, how to recover from that. So is it that you're going to go out to eat and you might not have full control, like you're going to someone's house, who knows what was cross-contaminated, this, that, the other? Is it about packing your digestive enzymes? Is it about making sure you have a good night's sleep the next night? If you're going to be drinking, make sure you're, drinking water between drinks, like how to actually boost that resilience so that you're able to recover. Because it's when you can't recover that will go on and create the pathogenesis of whatever it is that you're vulnerable to, right? That where that inflammatory cascade will then go on to create symptoms and stuff like that.
Yeah, I 100% agree with the whole individuality thing. Every person is different. It even goes to the emotional side. I mean, everybody experiences different emotional things throughout their life. Physical traumas, a woman who has had a baby with C-section, their fascia is different. So comparing you to somebody else is you can use that as hey, that worked for my friend, I'm going to try it. But just because if it doesn't work doesn't mean like you should throw everything out the window. You're an individual. You've got to figure out what works with your body's chemistry, what works with what you've got going on situational, but you also can't get discouraged or down or depressed because you're seeing everybody else, what works for them. You just haven't found that technique or that thing that works for you. You just keep searching. And that's what I will tell our listeners is that, whether you've tried gluten-free, dairy-free, all the things that we've suggested on the podcast and it's not working, there's other things. There's always other things that can be worked on, and I love that we've never really talked about the fascia before on the podcast. And I think that's a great option for people who have gut issues, who've done the testing, who've done the food diet, elimination diet, have healed the leaky gut, and they're still having issues. There may be a physical limitation to healing the gut that they can often look into.
Totally. Yeah.
Yeah. And I think one of those things that we really have to consider as we start working on people from the standpoint is, and it's really important. I had this discussion last night with somebody, and they were talking about like balance issues, and they talk to their friends, and their friends say, yeah, once you have a balance issue, you can't get rid of it. I went to see a neurologist, and that's it. They just don't know. It's idiopathic, they said. I'm like, right, because there's no, you don't have a pathology, you don't have a tumor, you don't have a mass. But the reason we sometimes see these conditions continue to be like a forever condition. Once you have high cholesterol, you're just going to have high cholesterol. Once you have diabetes, you're going to have diabetes, is because the difference, and it's really, I think, an important part when we talk about bioindividuality, is because the difference in allopathic medicine versus functional medicine is, in functional medicine, we're really looking for the pre-condition, right? We're looking to find the dysfunction before it becomes a disease. Whether we're looking for the problem in the fascia before it becomes a pain, a condition, right? And so we look for those things. In allopathic medicine, they're much better at saying, hey, we're going to find this tumor, this mass, and we look at all these amazing tools we have. And I think it's frustrating sometimes for the lay person who doesn't feel well. They go to somebody and they're like, it's just an idiopathic thing. And the reality is, it's idiopathic because we're not spending the additional time to help you understand what's causing it and identifying and removing whatever those danger signals are that are creating the problem. And the other piece of that from a bioindividuality standpoint is that, and which both of you guys were talking about, was what's causing your symptoms, right? Your thinning hair, your belly fat, whatever, could be caused by 10, 15, 20 different things. So you line up 20 people who have belly fat, it could be for 20 different reasons. And that's tough for the layperson, because we kind of were built in this, or educated in this model, that if you have X, it's caused by Y, right? And you take Z. And so, but that's not really reality. Medicine's still kind of doing that. If you have diabetes, you take metformin, and then when that doesn't work, then we put you on insulin. But it doesn't work for a lot of people, and so we get frustrated, right? If you have you don't have a thyroid problem until your TSH is high and your T4 is low, and that's when we start to put you on more thyroid hormone medication. Well, if my body's actively trying to get rid of this stuff, why would putting more in there help me, right? And so I think for the listeners, it's really important to understand that we're all unique, and we have to start looking at ourselves. And it can be frustrating sometimes when you go into a functional medicine practice and you say, what are the 4 supplements? What are the 2 exercises, right? That you can give me that are going to fix this. And we go, I don't know. We got to figure that out. Well, what does that mean? I mean, why can't you just tell me? Because there isn't a simple strategy that works for everybody. Would you agree with that?
And it will change. So this is why, the body will start to learn how to use what you start to give it, or it'll get used to the diet you're doing. And then, in our practices, we'll be like, all right, now we need to put you on this, or change that, or do this. And it's like, oh, why? No, because the body is now learning, and it's smart, and it's continually evolving and healing and changing and responding to the environment that we're in. And I think we somehow lost the plot on that. The body's so resilient and constantly changing, constantly. Like if you take a blood sample of someone and then tell them the most terrible news in the world, and then retest their blood, their chemicals that were in their blood 1 second before are completely different, right? So I think we need to start respecting this mind, body, soul, spirit connection thing that we have going on, and that it's constantly a fluid thing. It's not, to your point, high cholesterol med, like that could be different tomorrow. That could be different next month. We're constantly evolving and changing, and, respecting that nutrients or pharmaceuticals, it is impossible, and thank God it's impossible, to only affect one pathway in the body. It's impossible. So you are bound to get effects or side effects in other organ systems and other areas. And I mean, that's the beauty of plant medicine and herbs, botanicals, vitamins, nutrients, is that they do work on so many pathways that they can boost our health in that respect. But, it's very important in pharmaceuticals to understand that never, ever, ever can you just tease out one pathway. It just doesn't work like that.
Mm-hmm.
Yeah, we have to, it's so important to understand both. We see it in medicine, right, all the time, but we also have to see, we also have to be aware that in functional medicine too, when we're using those things, like when you take a blood pressure medication and it lowers it, really what we should be, and what we do in functional medicine, say, well, why is the blood pressure elevated to begin with? But when getting back to the resiliency thing, you say the body's super resilient, right? The body is trying to increase your blood pressure to get blood flow to your extremities in your brain. Then when you inhibit it, the body's still resilient. It'll figure out another way to raise blood pressure. And then we come in and we down regulate that. And then guess what? And a year later, hey, that blood pressure, those 2 blood pressure medications aren't working. I got to take a 3rd one.
And now we have no CoQ10 at all.
Right. And the body's so resilient. It's saying, listen, I need to perfuse my tissues. I need to increase blood pressure. What we see on the surface is the vanity thing, right? That, hey, I've got high blood pressure, I'll fix it. And we didn't fix anything. Just like tattooing your eyebrows on may make you feel good temporarily, but you didn't fix anything, and you're going to have to tattoo more or fix something else. But we have to be cautious of that in functional medicine too, because that's who the patient you see coming in with 25 supplements and you say, listen, you're way over supplemented here. And the first thing we got to do is get you off of these things. And they're like, no, I need this one. I need this one. I need this one. And, you know, it's a discussion we all have. If you need 25 supplements to feel this lousy, you don't need any of them, right? Because they're not really doing the job. And what people really miss sometimes is the organisms that live within us, they use those nutrients too. So many times in an effort, the things that you thought were helpful in the beginning are now just feeding part of your problem. But the body's resilient. Once you start to, if your function really starts to get back there, you don't need high doses of B6 or B12. Those things can then start to become problematic. So you can't get married to your supplement or your medication as the fix, because you can't drug or supplement yourself long-term healthy. You have to fix root cause issues, right?
I couldn't agree more. Yeah.
All right. So we can talk about this for days.
I know.
We all have things. So I say we wrap this puppy up, right? And maybe we'll get you back on here in a few months and kind of finish up some more topics, some more discussion here. But I know we got to leave. We typically leave our listeners with a couple tips, okay? And even though we just got done talking about all those things, people want to have flatter stomachs, and they want to see their six-pack abs. So even though we all have a little vanity and everybody still is going to say, but come on, give me a couple tips that I can start to work on. If there were a few tips that you could give the listeners who are worried about their muffin top or worried about their abs, what would be those 2 or 3, 4 tips that you would provide them?
Well, the first one I would say is hydrate, but don't drink your water with your meals, because that's one of the things I think people get wrong. So flushing that water between meals is excellent for helping digestion and bowel movements, which also help get rid of what's in the gut, the stomach, the midsection. The second thing is to pay attention to your poop. What's happening? What's coming out? Are you going every single day? Because you should be. And this conversation, I could talk till I'm blue in the face. Like, if people are not going every day, that is constipation. That is something is going on and it needs to be remedied. So that's the second thing, is like, how is it coming out? Can you see what you ate coming out in it? So that would signal you're not absorbing the things that, again, your cells or your thyroid or whatever might need. So that's very important, because again, that has to do with metabolism. I think that we're an overfed society personally. I think there's way too much snack meal, bedtime snack. So I'm a huge proponent of a 12-hour fasting window at least. So get that empty stomach in. To your point, that's when our migrating motor complex comes in. That's when that peristaltic activity of the gut, that's when that sweeping mechanism is coming through to clean what's going on in the gut. So I give my patients the example of a Zamboni. The Zamboni can't come by if there's skaters on the ice. So that's probably so Canadian of an example, but I'm just going to go with it.
You just have better hockey than we do. That's all.
Yeah. And then what I already spoke about is only push yourself, whether it's through food or staying up late or choosing alcohol or stuff like that, when you know you can recover from it. So even our body would self-regulate. We're not going to party 4 days in a row super hard, right? We do that first day, or like, oh, I can't, right? So our body is self-regulating. So tune into that stuff. You eat a heavy meal one day, the next day you're like, no, I got to eat lighter, right? You don't have Thanksgiving every single day for a week, right? So it's about tuning into those small things to find only step outside the lines when you can recover. And for some people, that might be once a week. That might only be once a month, right, to start. So those push points, so only know when you can make those splurges. And then a lot of people, we talked about fascia. So fascial release is so available to you through, again, any type of tool, from a foam roller to a tennis ball. There's a million things online to show you that. Even self-release, I'm showing with my hands because I can't show my stomach, but if you're, rubbing your stomach, even to just help in that clockwise direction to help move things down. And then the last one would be breath. So again, it's really important to slow down your breath and to expand the rib cage and to allow your body to know that you're safe, that you're not in that danger mode, so that we can burn the fat metabolically that we want to burn, and tell our bodies to do those building up, healing, cellular repair activities that don't otherwise happen when we're in our sympathetic state. So I hope those are some quick actionables that everyone can take away.
Yeah, no, those are great tips.
Somebody was thinking you were going to say, okay, 1,000 crunches a day.
Yeah.
Right?
Yeah.
Okay. So let's, can you just tell listeners where they can find you? We'll put your information below, but where can they find you?
Yeah, so you can find me on Instagram. I'm at dr.shalinibhat, ShalinibHat. You can follow my clinic too at the Movement Boutique, and we put out tons of content. You can follow my YouTube channel, the Movement Boutique, and the show is called Chat with Dr. Bhat. We're in our second season now. And on our website, we have a really cool program. It's all my curated tips. So it's a 2-week program. Every day you'll get an email for 2 weeks on a small actionable that you can do to push your health forward, which is exactly what we talked about. And lastly, to leave you guys on a note, just, you know, as much as we talked about vitality is a new vanity, I just want to emphasize to all the women out there that no matter where you are, we like love your body. It's exactly where it should be. And it is doing what it knows best to do to keep you alive right now. And in that sense, if you are feeling that something's off or a little bit this, that, think that maybe there's something at the root, even if you're not experiencing a symptom per se that's persistent, or that it has a label, or if your doctor said, no, you're normal, there just might be something subclinical going on at the cellular level.
Yeah. There's
awesome.
always something subclinical before there's something clinical. So that's,
yes. And that's the time when it's subclinical is when we can make the biggest difference, right? So I tell my patients, if someone comes to you and they're bankrupt and they're like, okay, I want to be a millionaire, you're like, this is going to take a long time, right? If you come and you're like, hey, I have this much savings and I want to be a millionaire, you're like, all right, I can work with this, right? This is how we'll do the strategy to build you that wealth, right? And that's what we do in functional medicine. We're building your health. So don't wait until the last minute.
awesome. All right. Awesome. I think we'll wrap this baby up. You guys can get on with your day. And for the listeners, download the podcast, tell your friends, tell your family, put some nice reviews on, and share the word that we're out there trying to spread the message of healthcare and vitality, right? So thanks so much for being on the podcast.
Yeah, thanks for having me.
Everybody have a great day.
Yeah, you too. Bye.
You too.